Good day everyone, I am Cynette Danielle Caseres from BSN 3B and today I'm going to perform a return demonstration regarding the Glasgow Coma Scale. So the definition of the Glasgow Coma Scale or GCS is an assessment tool designed to note trends in the client's response to stimuli. The Glasgow Coma Scale can be used as an effective assessment tool in order to achieve a clear and objective evaluation of the patient's neurological status. The Glasgow Coma Scale is a standardized scoring system used to assess level of consciousness in a patient. So the Glasgow Coma Scale has three aspects of the patient's behavior are observed and recorded: eye-opening, verbal responses, and motor responses to a verbal command or painful stimulus. These assessments are further subdivided into different levels of response. The purposes of the Glasgow Coma Scale is to monitor level of consciousness in any patient who has altered sensorium, and to monitor patient with suspected or confirmed brain injury. So there are three special considerations when performing the Glasgow Coma Scale. First is that there are multiple limitations that can alter the score and not provide an accurate picture of the patient's brain injury. Second is that consideration is made for those with tracheostomy and endotracheal breathing tubes. And lastly, assess for presence of injury and edema prior to stimulation. First procedure is to check physician's order or nursing care plan for frequency. Gather necessary equipment such as Glasgow Coma Scale form, gloves, and pen light. The next procedure is to perform hand washing. This is to prevent transmission of microorganisms. Identify the client. Good day, sir. Natawan ko yung mga identification band, sir, ha? Provide client privacy by making sure that the client is not well exposed to other patients or other people. We should also consider the closing of hospital curtains and doors. Introduce self and explain procedure to the patient. Sir, ako gali si Cynette Danielle Caseres, isa ka student nurse ng University of San Agustin. Ari ko disubong para mag-perform sa imo sa Glasgow Coma Scale para mabalaan tang imo nga level of consciousness. We should wear gloves to reduce the risk of contamination and nosocomial infection. Position patient appropriately to keep the patient comfortable. Sir, i-position ko ikaw, sir, ha? If the patient's eyes open spontaneously, the score is 4. But if the patient's eye don't open spontaneously, talk to the patient. Sir, good afternoon. Kamusta mo pa matiyag, sir?
Okay, yeah.
If the patient has responded to sound, this will be scored as a 3. If the patient doesn't respond to sound, assess the patient's pain stimulus. If he responded, this will be scored as 2. Sir, sakit, sir? And if there is no response at all, this will be scored as 1. Ask the patient about his name and what day is today to know if he is oriented. If the patient answered your question correctly,
he will be scored as 5.
Sir, pwede mo mahambal ang imo nga bilog nga pangalan?
Ako si Josh Axel Espina.
Balaan mo kung ano nga adlaw, kag ano oras subong, sir?
June 18, 2021. Alas 8 sa aga.
If the patient is confused, he will be scored as 4.
Sir, pwede mo ma-state ang imo nga bilog nga pangalan, sir?
Ang ano to ganit, day?
Ang imo nga bilog nga pangalan, sir, pwede mo mahambal sa akon?
If the patient answered inappropriate words, the score given will be 3.
Sir, pwede mo mahambal ang imo nga bilog nga pangalan, sir?
May duwa ako ka bata.
Hindi, sir. Ang ginalamin ko ang imo nga pangalan, pwede mo mahambal sa akon?
Ato sila sa eskwelahan, day.
If the patient answered in incomprehensible sounds, the score will be 2.
Sir, pwede ko mabalan imo bilog nga pangalan, sir? Ha? Liwat, pwede mo maliwat, sir? Kay medyo hindi klaro ang imo hambal, sir?
And if there is no response at all, the score is 1. Command the patient to know his best motor response.
Sir, pwede mo pagbuhain mo nga dila, sir?
If the patient does not obey command but localizes to pain, he will be scored as 5. If the patient does not obey command, does not localize to pain, but withdraws to pain, he will be scored as 4. If the patient responds only with abnormal flexion, the score will be 3. If the patient responds with abnormal extension, the score will be 2. If there is no response at all, the score will be 1. Document responses in GCS sheet. Make sure to add total score at the bottom of sheet during each assessment. Document accurately and report for changes if any.